So Florida Governor Rick Scott is finally getting his chance to sign a bill that will defund Planned Parenthood in Florida. Now, during a March 2nd hearing on the proposal, state lawmaker Lori Berman asked bill co-sponsor Colleen Burton to elaborate on whether or not the women in Florida will have alternative sources for women's health care. Now remember, Planned Parenthood, most of it, 97% of it, Planned Parenthood's things that they do is women's services, pap smears, contraception coverage, and cancer screenings. A lot of great stuff for women. Okay, a lot of stuff, a lot of women's health care that they need that they can get at an affordable price, sometimes free if their income allows it. Well, very, very vital services for women. So this Lori Berman asked Colleen Burton, who is of course pro defunding Planned Parenthood, hey, where are these women going to go for these essential health services? Well, Burton replied, quote, we have 52 federally qualified health centers. The counties have health departments, physicians' offices, independent clinics would be eligible if they apply to mental requirements. Okay, so that's not that good of an answer. Berman pressed Colleen Burton further. Are some of these FQHCs school board health clinics? Not to my knowledge, replied Burton. Are some of those FHCs podiatrists' office? Remember, podiatry has to do with feet, a foot doctor. Not exactly qualified for dealing with women's health, especially reproductive health. Burton responded, are you asking me if FCHCs are podiatrist's office? She seemed surprised. That exchange ended with Berman asking Burton for a list that Burton said she had seen that had all of these different alternative sources for healthcare for women. So, who's on this list? You'll love this. 2 Salvation Army's offices. 38 dental offices? Well, wait a minute, what does that have to do with women's health care? 38. Okay, well, the list continues. It gets worse. And 67 elementary and middle schools. Those are the women's health care centers that will replace Planned Parenthood in Florida if this bill goes through. Those? The Salvation Army? I'm sorry, when's the last time you knew you could get a pap smear from the Salvation Army or from a dental office? That's absolutely ridiculous. In the middle school and elementary schools. Imagine going to your school nurse, your kid's school nurse, for like, hey, I need some contraception. Hook me up. Excuse me? They offer those services? I don't think so. Absolutely ridiculous. Now, Chris Estes, who is the chief medical officer of Planned Parenthood of South, East, and North Florida, says, quote, what this would do, this bill, would take away the funding for programs that are primary care. Cancer screenings, STD screenings and treatment, pap smears, birth control. These are services that women in great need are accessing at Planned Parenthood. These are not-for-profit programs for patients who don't have insurance, don't have money, and can't afford to go elsewhere for it. And that's exactly why Republicans want to cut it. They don't want poorer women having access to health care or even contraception. They want to keep these people down. They want to keep these people poor, these women poor, by not allowing them to access contraception or have any sort of women's health. If you're poor, you don't deserve health care. That's the Republican mantra. Maybe you need to work a little harder. That's exactly what they're trying to do. And that's exactly why it's wrong.